Hello, welcome back to my channel. My name is Susan and I'm so happy that you are here. I'm a first-time mom to my daughter Julia, and I also have a brain tumor and epilepsy. So let's talk about it. Today's video is about seizures and anti-seizure medicine. I'm going to give you my experience that I've had in the last couple of months, both with seizures and the diagnosis, and then leading to anti-seizure medicine, what is working for me, some of the side effects I've experienced, and what we are currently doing. In my last video that I posted, I talk about my epilepsy diagnosis. I define epilepsy and I go through in detail the different types of seizures there are. So if you're interested in that, please go back and watch that. For the sake of this video, I'm going to stick to just seizures and anti-seizure medicines. Leading up to the diagnosis of the brain tumor and being told I have epilepsy from the brain tumor, I was experiencing partial seizures every day that were increasing with stress and increasing with sleep disruptions. I had a newborn at the time, so the sleep, totally understandable. And the stress was coming from my daughter starting daycare at 6 weeks old and going back to work. And then when I got back to work, it was pretty stressful, just a rough transition for me. I've never really liked change, so that's not really a surprise. I have an entire video on what my seizures looked like. I will include that here so you can just get a gist of what I was experiencing. This is what it looks like to have a brain tumor from my perspective. My tumor is in my occipital lobe, which controls the right side of my vision. Everything I'm about to show you is only ever on the right side of my vision. And what I'm seeing is actually seizure activity caused from the brain tumor. When I was 2 weeks postpartum, I started seeing colors like this. I thought they were ocular migraines and assumed they were hormone related. As going back to work got closer, I started getting more stress and it turned into something like this. These bright flashy lights would kind of move in a circular motion and it would take up to 80% of my vision on my right side. And they were more circular like this. By the time I got back to work, this was happening up to 15 times a day. And then directly after this would happen, I would have this blurriness that would last up to 10 minutes. This is a really good image of like what it would look like when it was happening. This is another pretty accurate representation of what was happening. This was happening every day for months, and then I had a grand mal seizure, which is what diagnosed the tumor. Questions in the comments. So this was happening for weeks, and then I had a tonic-clonic or grand mal seizure. I lost consciousness, was having convulsions, was not responsive, lost muscle control, lost bladder control, the whole 9 yards. They called 911. I was brought to the hospital. That's where they did a CT scan, and they found both where the seizure started, where it ended on the other side of my brain, and I lost consciousness because when a seizure crosses, I'm going to call it the midline. I don't know what it's actually called, but the middle of your brain, when it crosses, that's when you lose consciousness, and that's when it's considered tonic-clonic. And then they also found the brain tumor. So they immediately put me on Keppra, which is an anti-seizure medicine. I was breastfeeding at the time, so that was a safe option for both me and my daughter. And the seizure stopped completely. So I had the diagnosis and started the medicine on October 18th, and I was seizure-free for the first time in 3 months until around it was the week of Thanksgiving. So I went a whole month without having any seizures being on this medicine. Then the week of Thanksgiving, I think it was Monday or Tuesday, I was one of my first days being home alone because I had had babysitters every single day leading up till this point, which was doctor recommended. First day home, one of my first days home alone. I don't think it was the first day, but it's home alone, and I had 10 partial seizures within an hour. So I obviously called Chris, let him know what was going on. My parents live a mile up the road. They immediately get here. Chris called the medical team as he was driving home. They all conversed. They doubled my anti-seizure medicine. They made me take a double dose right then once they found out. And then from there on out, my medicine was doubled. By Thanksgiving, so let's say 2 days, I was experiencing side effects that were just horrible. Completely down in the dumps, depression, increased anxiety. I was having thoughts of unaliving myself, which none of this is anxiety. Yes, that's normal for me, but the depression and the terrible thoughts were not in the regular for me. That is not me at all. It was Thanksgiving, so no one was in office for 5 days. I couldn't get a hold of anyone. But let me rewind time. I had neuropsychology testing for my cognitive abilities to have a baseline. So every patient goes through this. You have a baseline, so if you do end up having surgery, then you do the testing again and you see if there's any difference from then till now. And then they also wanted to see if I had permanent damage or the likelihood of permanent damage from the original seizure. When I finished that testing, it came back that my cognitive abilities, I tested as a high functioning person, which I'm very proud of. However, I'm having a really hard time accessing that cognitive ability. That is because my brain frequency and waves are slowed down in order to slow down or stop the seizures because of the Keppra. The neuropsychologist was actually the first one to raise the red flag and say, I don't think this is a good medicine for you. Like you have the abilities, but you can't access them, and that's why you're feeling so frustrated and having these problems, which obviously didn't help. It added to the depression and anxiety where I felt like my brain didn't work. And I'm still very much in that boat. I think I've accepted that this is just where I'm at right now, and I'm giving myself a lot more grace, and I've made peace with that. But I'm also very hopeful that getting off of the Keppra, I will get more of my brain function, creativity, organization, and the skills that I really prided myself on. High level thinking is what I struggle with, and I cannot multitask anymore. I used to be at like peak performance when I was doing 3 things at once. And now it's like I have to do one thing at a time. I have to be hyper focused. And if I'm not getting it done. Like I can't even really cook and talk at the same time. And again, those are side effects from the Keppra, which I wasn't expecting. So after the neuropsychologist had said, I don't think the Keppra is a good fit, I then had met at this point with 2 neurologists and a neurosurgeon, and we were all on the same page. We all agreed, like, this is not a good fit. We need to figure out something different. So then they started the process of getting me onto lamotrigine. That is another breastfeeding friendly anti-seizure medicine and can be taken for a long period of time. When transitioning, they don't like to transition anti-seizure medicine because in that transition period, there's a very high chance of having seizures, and they don't want they don't want any seizures, but they really don't want grand mal tonic-clonic big seizures, which that is a risk factor in changing medicines. The choice for lamotrigine was based on a couple things. One, I was still breastfeeding at the time. 2, it is not a depressant like the Keppra is. And the third one, which I really appreciated this, it was the first time any doctor had kind of asked me about my future, not just what I was going through in the moment or past events leading up to the grand mal seizure. And it was based on family planning. He said, do you want more kids? And I was like, well, I want to deal with the brain tumor first. I really haven't, I thought that was kind of, that option wasn't there for me anymore. He was like, no, not at all. Like, I want to make sure that we choose this medicine based on your goals. And if getting pregnant again is one of the things you want from life, then we need to take that into consideration because we don't want to be changing your medicine again. We need something that's safe for pregnancy, breastfeeding, and the whole 9 yards, which I really appreciated the fact that he even thought that I had a future. Because, I mean, at this point, when we're having this conversation, I thought I was toast. Like, I couldn't even picture making it to the summer, let alone being able to have another kid. Like, that, I thought that I was mourning and letting go of that idea, which I have another video coming where I'm going to talk about fertility, the reality of my case, where I'm at, and just family planning in general, and my fertility planning. That's in the works. You will be seeing that video soon, but that's a little off topic, so I don't want to get into it in this video. So with the building up process of the lamotrigine, you can't just jump in and you cannot just start taking the same dose or an equal amount of dose. You can't just jump in and take the equivalent of the Keppra to the lamotrigine. You have to build up on the lamotrigine. So we started at 25 milligrams once a day and then gradually built up. It has been, I don't even know how many weeks. 4, 5, 6, 8, 10. It's been 12 weeks now. And then they did my blood work. My lamotrigine levels are nowhere near where they need to be in order to take me off the Keppra. That's not a huge surprise. I've still been having breakthrough seizures. I had a seizure this morning. Like that wasn't surprising when my blood work came back. So they're continuing to increase my lamotrigine, and they actually just doubled it this week. So now I'm taking 100 milligrams twice a day, where I was taking 50 milligrams twice a day. Again, we will repeat. We'll do another blood test, see if my levels are where they should be. And the goal is once my lamotrigine levels meet or match my Keppra levels, then we can wean me off of the Keppra. Or if I'm still having seizure activity, they'll again increase the lamotrigine, blood work again, then wean me off the Keppra. And at that point, if I'm at the highest dose of lamotrigine and I'm still having breakthrough seizures, then we talk about changing to a different anti-seizure medicine. I had a cold last week with the increase so I had a cold last week. When I was coming down with the cold, I had a lot of seizure activity, which wasn't super surprising. In every appointment, they ask me if I've been sick, if I'm feeling well, or if I feel like I'm coming down with something. They are very concerned with me getting sick of any kind because there's an increase of fluid in your body when you get sick. And your body just reacts to different things in different ways. So because I hadn't been sick since the brain tumor diagnosis and being on a new medicine, they just didn't know how I was going to react. I had 8 seizures the day that I really realized like I was coming down with something. Because of that, the neurologist finally called me back and was like, well, I reviewed your blood work and coupled with the log you sent us of how many seizures you had, I want to add a third anti-seizure medicine. At this point, I was already pretty testy about the whole situation. My blood work had come in 11 days prior to this conversation. I had sent my log of seizure activity on Tuesday or Wednesday, and I hadn't heard back from anyone. I didn't hear from anyone till the following Monday. So I was already fired up when I got this phone call. And then they wanted to add a third medicine to the mix. And I explained, I said, the last time we added an anti-seizure medicine to my palate, I had an increase of seizures. And I was assured that that was normal because any additional anti-seizure medicine is very likely to increase seizure activity. I said, so I don't think that we should add another thing that could give me more seizures. Why are we not just increasing the lamotrigine like the original plan? And they're like, well, we were really concerned because you had so many seizures. I said, I had a lot of seizures last week when I was sick and no one got back to me. And no one responded to my message 2 days later of asking, can I take Mucinex or Sudafed? I had a head cold. Can I take something to relieve the pressure in my face? Like, I've never been on a long-term medicine. I don't know what I can and cannot take. No one has responded to me. I'm very grateful and thankful that my sister is a pharmacist and I had access to ask her, because after 3 days of not hearing from anyone, I was like, I need relief. And I'm gonna ask my sister. I try not to because that's her job. I don't want her to have to like do work on the weekends, But anyways, I'm very grateful that I had that resource to consult with. I was able to take Mucinex, and then I was literally better in 24 hours. So the moral of that story was that you can advocate for yourself. You know your body, and you can have a gut feeling. Let your doctors guide you, but at the end of the day, you need to be in charge of the decision making and how you go about what you're putting into your body. That is going to be a whole another video as well, is advocating for yourself in the medical field, because if you're not advocating for yourself, you are just going to get pushed in whatever path of least resistance it is. Again, I'm not going to jump down that rabbit hole. It will be a separate video, so stay tuned for that. Like I said before, we are increasing the lamotrigine. I am now taking double what I was. We'll do the blood work. And if at any point I'm at like the highest dose of this medicine and I'm still not seeing I'm still having breakthrough seizures or any sort of symptoms from the brain tumor, then we're going to scrap this, either try a third and final anti-seizure medicine if that still doesn't, so this is kind of like the utility player, if you will. So either try a third anti-seizure medicine, or that's when we start looking into surgical options. and I will do a whole video on how we are choosing a brain tumor treatment plan and the different factors that go into that. Again, separate video. If you guys have any questions about seizures or my anti-seizure medicines, please drop them in the comments. I will respond to them when I can. I've been really bad about responding to comments, and I read them as they come in, but I don't like to respond on my phone. I like to type on a computer because I can be more thoughtful and intentional and be like a little more long-winded. And I usually set aside like one day a week to like sit down, and it takes me usually almost up to 2 hours sometimes to respond to each one of you. So it's not that I'm ignoring you. It just takes me a little bit of time, and I am going to try to be more intentional of doing it more frequently than once a week. And I want to just say thank you so much for watching this video. I hope that it was educational, informative, and helpful to you if you are going through something similar, or just the message of being able to advocate for yourself and knowing your body and knowing what you want or don't want to put into it. So again, I appreciate you so much for watching this video. It means the world to me and my family. Thank you so much for the kind comments. Your thoughts and prayers mean so much to us, and I will see you in the next video.